What attracted you to aged care nursing, and what do you find most rewarding about working with older adults?
My attraction to aged care nursing stems from a profound respect for the wisdom and experiences that older adults carry, combined with a deep understanding of their unique healthcare needs. I've always felt a particular connection to the elderly, recognizing their vulnerability, but also their immense capacity for joy and contribution, even in later life. This field offers a unique opportunity to provide truly holistic care, encompassing not just physical well-being but also emotional, social, and psychological support, which is something I find incredibly fulfilling. I believe that providing dignified and compassionate care to those in their twilight years is one of the most important roles in nursing, and I am drawn to the profound responsibility that comes with it. What I find most rewarding about working with older adults is undoubtedly the deep, meaningful relationships one can build. It's incredibly satisfying to spend time listening to their life stories, understanding their preferences, and seeing the positive impact of even small interventions that improve their comfort, dignity, or overall quality of life. Witnessing a resident's face light up from a simple act of kindness, or helping them maintain a level of independence they fear they had lost, brings immense personal satisfaction. Furthermore, being able to provide comfort and support to residents and their families during challenging times, especially towards the end of life, is a privilege that highlights the true essence of nursing. It's a field where you constantly learn, not just clinically, but also about life itself, and that continuous personal and professional growth is deeply rewarding.
How do you define person-centered care in the context of aged care, and why is it important?
Person-centered care in aged care is fundamentally about placing the individual resident, rather than their diagnosis or routine tasks, at the absolute core of all care planning and delivery. It's an approach that recognizes and respects the unique identity, preferences, values, beliefs, abilities, and life history of each person. This means actively listening to residents, understanding their likes, dislikes, habits, and what truly matters to them, and then tailoring their care around these specific elements. It involves empowering them to make choices about their daily lives, from what time they wake up or eat to the activities they engage in, fostering their autonomy and maintaining their individuality. Ultimately, it's about viewing each older adult as a whole person with a rich past and individual desires, rather than merely a recipient of medical services. This approach is profoundly important for several reasons. Firstly, it significantly enhances the quality of life for residents, leading to greater happiness, contentment, and overall well-being because their care aligns with their personal desires, not just generic protocols. By promoting dignity and autonomy, person-centered care upholds the inherent right of older adults to self-determination, which is crucial for maintaining their self-worth and mental health. Clinically, it can lead to improved outcomes, as residents who feel heard and respected are often more engaged and cooperative with their care plans. Furthermore, by addressing underlying individual needs and preferences, it can effectively reduce instances of distress or challenging behaviors that often arise from a feeling of being misunderstood or having choices taken away. Finally, it builds stronger, more trusting relationships between residents, their families, and the care team, creating a compassionate and respectful environment for everyone involved.
What do you believe are the biggest challenges facing aged care nursing today, and how do you envision contributing to solutions?
The aged care nursing sector currently faces several significant challenges that profoundly impact both residents' quality of life and the sustainability of the workforce. One of the most pressing issues is the global shortage of qualified nursing staff, exacerbated by an aging population and increasing demand for complex care. This shortage often leads to high nurse-to-resident ratios, increased workloads, and immense pressure on existing staff, which can compromise the delivery of high-quality, person-centered care and contribute to burnout and high turnover rates among nurses. Furthermore, the increasing acuity and complexity of residents' health needs, including a rising prevalence of dementia and multiple chronic conditions, demand highly skilled and specialized nursing interventions, requiring continuous professional development and robust training programs. Another significant challenge is maintaining morale and preventing emotional and physical fatigue amongst care staff, who frequently deal with challenging behaviors, complex family dynamics, and end-of-life care. This can lead to compassion fatigue if not properly managed through adequate support systems and a positive work environment. Additionally, ensuring adequate funding and resources remains a perennial struggle, impacting everything from staffing levels and facility upgrades to access to technology and specialized therapies. There's also the ongoing challenge of integrating technology effectively into aged care, ensuring it genuinely enhances care delivery and resident well-being without dehumanizing the care experience or creating new barriers for staff and residents. I believe I can contribute to solutions for these challenges in several meaningful ways. Firstly, by committing to continuous professional development, I can ensure I possess the most current knowledge and skills required to manage complex geriatric conditions, thereby contributing to higher quality care and reducing the burden on colleagues. I am particularly keen on specializing in dementia care, as I believe enhancing skills in this area is crucial for improving outcomes for a significant portion of the aged care population. Secondly, I aim to be a proactive advocate for staff well-being and positive team dynamics. By fostering open communication, offering support to colleagues, and actively participating in mentoring new nurses, I can help create a more resilient and cohesive workforce, potentially mitigating burnout. I also intend to champion person-centered care principles rigorously, actively involving residents and their families in care planning and decisions. This approach, while requiring more time and communication, ultimately leads to greater resident satisfaction and can reduce challenging behaviors, improving the overall care environment. Finally, I'm eager to embrace and help implement appropriate technological solutions that genuinely benefit residents and staff, such as digital health records that streamline documentation or assistive technologies that enhance resident independence, ensuring that innovation truly serves a human element of care.
Where do you see yourself in your aged care nursing career in the next 5 years?
In the next 5 years of my aged care nursing career, I envision myself not only as a highly skilled and experienced clinician, but also as a contributing leader within the aged care community. My primary focus will be on deepening my expertise in geriatric-specific clinical areas, particularly in managing complex chronic conditions, advanced dementia care, and comprehensive palliative care. I plan to actively pursue relevant certifications or postgraduate courses to solidify this specialized knowledge, ensuring I can provide the highest standard of evidence-based care. Beyond direct patient care, I aspire to take on a more senior or mentorship role within a care team. I am keen to utilize my accumulated knowledge to support and guide less experienced nurses and carers, fostering a collaborative environment that prioritizes resident well-being and continuous learning. I believe I can contribute significantly to quality improvement initiatives, perhaps by leading projects focused on enhancing safety protocols, optimizing pain management strategies, or improving communication between residents, families, and staff. Ultimately, I see myself as an integral part of a forward-thinking aged care facility dedicated to upholding the dignity and quality of life for older adults, while continually seeking innovative ways to elevate nursing practice in this vital sector.
Describe your experience with common geriatric conditions such as dementia, Parkinson's disease, or chronic heart failure.
During my nursing career, particularly in aged care settings, I have gained substantial experience in managing a range of common geriatric conditions, including dementia, Parkinson's disease, and chronic heart failure. With residents living with dementia, my approach has always been deeply person-centered, focusing on understanding their individual triggers and preferences to create a calm and predictable environment. This involves utilizing therapeutic communication techniques, validating their feelings, and implementing strategies to manage challenging behaviors like agitation or wandering, always prioritizing their safety and dignity while maintaining their routine and promoting engagement in meaningful activities. Regarding Parkinson's disease, my experience includes meticulous medication management, ensuring medications are administered at precise times to optimize symptom control and minimize off periods. I've also focused on implementing comprehensive fall prevention strategies, assisting with mobility and activities of daily living to promote independence, and managing non-motor symptoms such as dysphagia through appropriate dietary modifications and monitoring. Understanding the progressive nature of the disease and providing consistent physical and emotional support has been key. For residents with chronic heart failure, my primary focus has been on vigilant symptom monitoring and effective fluid management to prevent exacerbations. This involves meticulous daily weight measurements, accurate intake and output monitoring, thorough vital sign assessments, and educating patients on strict low-sodium diets and fluid restrictions. I am proficient in administering cardiac medications, recognizing signs of worsening heart failure like increased dyspnea or peripheral edema, and promptly escalating concerns to the medical team for timely intervention. Across all these conditions, My aim is to provide holistic care that addresses not only the physical manifestations, but also the psychological and social well-being of the older adult, ensuring they maintain the best possible quality of life.
How do you approach a comprehensive geriatric assessment, and what key areas do you focus on?
A comprehensive geriatric assessment, in my approach, is a holistic and interdisciplinary process designed to evaluate an older adult's overall health and functional capabilities beyond just their medical diagnoses. It's a person-centered process, beginning by understanding the resident's own goals, concerns, and priorities for their care. This systematic evaluation aims to develop a coordinated and integrated plan of care that addresses all aspects of their well-being. I initiate this by gathering a thorough history, involving family or caregivers where appropriate and with the resident's consent, to gain a full picture of their baseline status and any recent changes. In conducting such an assessment, I focus on several key areas. Firstly, functional status is paramount, evaluating activities of daily living ADLs, such as bathing, dressing, and feeding, as well as instrumental activities of daily living IADLs, like medication management, shopping, and meal preparation, to determine their level of independence and need for assistance. Secondly, cognitive function is critically assessed through screening tools for delirium, dementia, or depression, as these significantly impact safety and the ability to manage their own care. Thirdly, a meticulous review of medical issues and polypharmacy is essential, scrutinizing all current medications, including over-the-counter drugs and supplements, to identify potential adverse drug reactions or interactions. Fourthly, psychosocial factors such as mood, social support networks, living arrangements, and coping mechanisms are explored, as these profoundly influence overall well-being. Lastly, I pay close attention to nutritional status, fall risk, and sensory impairments like vision and hearing deficits, as these are critical determinants of safety, quality of life, and prevention of complications. This comprehensive approach allows me to develop a truly individualized and effective care plan.
Discuss your experience with medication management in an aged care setting, including polypharmacy and medication reconciliation.
My experience with medication management in an aged care setting is extensive and has deeply emphasized the critical importance of precision and vigilance, especially given the complexities often associated with polypharmacy and transitions of care. In my daily practice, I rigorously adhere to the 5 rights of medication administration, ensuring every resident receives the correct drug, dose, route, time, and patient, followed by meticulous documentation and monitoring for therapeutic effects or any adverse reactions. This routine is foundational to safe medication delivery, but in aged care, the nuances of residents' cognitive status, swallowing difficulties, and medication preferences also play a significant role, requiring adaptable administration techniques and careful observation. A major aspect of medication management in this environment is addressing polypharmacy, which is the concurrent use of multiple medications by a resident, often leading to increased risks of drug interactions, side effects, and cognitive impairment or falls. I actively participate in medication reviews, collaborating closely with pharmacists and prescribers to identify redundant medications, assess the appropriateness of current therapies, and advocate for deprescribing when safe and beneficial. My role involves constantly observing residents for subtle signs of adverse drug reactions that might be easily mistaken for symptoms of aging or disease progression. Furthermore, medication reconciliation is a crucial safety process that I routinely engage in, particularly during admissions, transfers, or discharges. This involves systematically comparing a resident's current list of medications with new medication orders to identify and resolve any discrepancies. I take great care in obtaining a complete and accurate list of all medications, including over-the-counter drugs and supplements, by verifying information with the resident, their family, and previous healthcare records. Any discrepancies, such as omissions, duplications, or incorrect dosages, are immediately communicated to the medical team for clarification and resolution before administration. This diligent process is vital for preventing medication errors, ensuring continuity of care, and ultimately enhancing resident safety within the aged care environment.
How do you identify and manage common complications in older adults, such as falls, pressure injuries, or urinary tract infections?
In my practice, identifying and managing common complications in older adults, such as falls, pressure injuries, and urinary tract infections, involves a proactive and systematic approach. For falls, Identification begins with comprehensive risk assessments upon admission and regularly thereafter, utilizing validated scales to evaluate factors like gait instability, muscle weakness, polypharmacy, and visual impairment. I also meticulously review a resident's fall history and conduct environmental safety checks. Management then involves implementing individualized fall prevention plans, which may include prescribed exercise programs to improve balance and strength, ensuring access to assistive devices, optimizing medication regimens to reduce side effects like dizziness, and frequent hourly rounds to anticipate needs. If a fall occurs, immediate post-fall assessment and documentation are crucial to identify causes and prevent recurrence. Regarding pressure injuries, early identification is paramount, achieved through routine and thorough skin assessments, particularly over bony prominences, often guided by risk assessment tools like the Braden scale. I diligently monitor for subtle changes in skin integrity, temperature, or color, recognizing that older adults may not present with classic symptoms until an injury is advanced. Management and prevention strategies include meticulous repositioning schedules, typically every 2 hours, utilizing specialized pressure-relieving mattresses and cushions, maintaining skin hygiene and moisture balance, ensuring adequate nutrition and hydration to support tissue integrity, and promoting mobility whenever feasible. Any identified pressure injury is immediately managed with appropriate wound care protocols and ongoing assessment. For urinary tract infections, UTIs, identification in older adults often requires a heightened awareness, as symptoms can be atypical and present as acute changes in mental status like delirium, increased confusion, lethargy, or sudden decline in functional ability, rather than typical urinary discomfort. I closely monitor vital signs, observe urine characteristics for cloudiness or strong odor, and am quick to perform a urine dipstick test if concerns arise. Once suspected, management involves promptly notifying the medical team for diagnostic testing, typically a urine culture, and initiating appropriate antibiotic therapy as prescribed. Concurrently, I ensure the resident maintains adequate hydration, practice strict perineal hygiene, and encourage regular toileting to facilitate bladder emptying, all aimed at resolving the infection and preventing recurrence. This integrated approach across these common complications helps maintain older adults' safety and well-being.
Describe your experience with wound care, including assessment, dressing selection, and documentation in older patients.
My experience with wound care in older patients is comprehensive, encompassing meticulous assessment, informed dressing selection, and precise documentation, all tailored to the unique physiological considerations of the geriatric population. When assessing a wound, I begin by understanding its etiology, whether it's a pressure injury, surgical incision, or skin tear, as this guides the subsequent care. My assessment includes a thorough visual inspection and palpation to determine the wound's location, size, measuring length, width, and depth, and the characteristics of the wound bed, noting the presence of granulation tissue, slough, or necrosis. I also carefully evaluate the amount, color, and odor of any exudate, as well as the condition of the peri-wound skin for signs of maceration, erythema, or induration. Crucially, I always assess the patient's pain level associated with the wound and during dressing changes, as this directly influences their comfort and compliance. Dressing selection is then guided by this comprehensive assessment. For instance, a highly exudative wound might require a superabsorbent foam or alginate, whereas a dry wound bed might benefit from a hydrogel to provide moisture. Infected wounds necessitate antimicrobial dressings. In older adults, the fragility of their skin often influences my choice, leading me to opt for dressings with gentle adhesives or those that allow for less frequent changes to minimize trauma. I also consider the patient's overall mobility, nutritional status, and any underlying conditions like diabetes or vascular disease, as these significantly impact wound healing and determine the type of dressing and adjunct therapies needed. Accurate and timely documentation is integral to every aspect of wound care. For each dressing change or wound assessment, I record the date and time, the exact location and measurements of the wound, detailed description of the wound bed characteristics, the amount and type of exudate, and the condition of the peri-wound skin. I specify the cleansing solution used, the type of dressing applied, the patient's tolerance of the procedure, and their pain score. This meticulous documentation is vital for tracking healing progress or identifying deterioration, ensuring continuity of care among the nursing team, facilitating communication with the medical team, and providing a clear record for legal and quality assurance purposes. It reflects the dynamic nature of wound healing in older patients and informs ongoing care planning.
How do you establish rapport and build trusting relationships with older residents and their families?
Establishing rapport and building trusting relationships with older residents and their families is a cornerstone of effective aged care nursing, and it's a process I prioritize through consistent, empathetic, and respectful engagement. With residents, my approach begins with active listening. I dedicate time to genuinely hear their stories, preferences, and concerns, ensuring they feel truly heard and valued as individuals rather than just patients. I always address them by their preferred name, maintain eye contact, and explain procedures clearly and patiently, respecting their autonomy and dignity in every interaction. Consistency in my presence and care delivery also builds trust, as residents come to rely on predictability and a familiar, caring face. Finding common ground through shared interests or simply acknowledging their unique life experiences often helps to bridge any initial distance. Similarly, building trust with families requires open, transparent, and empathetic communication. I understand that families are often experiencing a range of emotions, from concern to grief, and they need to feel confident that their loved one is receiving the best possible care. I make a conscious effort to provide regular updates on the residents' well-being, progress, and any changes in their condition, proactively reaching out rather than waiting for them to inquire. Involving families in care planning and decision-making, while always respecting the residents' wishes and privacy, empowers them and reinforces their role as vital partners in the care journey. By demonstrating a genuine commitment to their loved one's care, offering clear explanations, and being responsive to their questions and concerns, I aim to foster a relationship built on mutual respect and unwavering confidence, ensuring that families feel secure and supported throughout their loved one's time in our care.
Describe a time you had to communicate sensitive or complex information to a resident or their family. How did you approach it?
I recall a situation where I needed to communicate to a resident and her family that her mobility had significantly declined due to a worsening chronic condition, meaning she would require considerably more assistance with daily activities and could no longer safely manage independent transfers. This was sensitive because she had always been fiercely independent, and the family was also very protective of her autonomy. My approach began with thorough preparation. I reviewed her medical history, recent assessment findings, and discussed the situation with a medical team to ensure I fully understood the extent of her decline and the implications for her care needs. I then arranged for a private meeting time when both the resident and her primary family contact could be present, ensuring a calm and uninterrupted environment. During the conversation, I started by acknowledging her previous level of independence and expressing my empathy for how difficult this news would be to hear. I used clear, simple language, avoiding medical jargon, to explain the observable changes in her physical abilities and the direct correlation to her safety. I presented the information in small, digestible chunks, pausing frequently to allow her and her family to process what I was saying. I paid close attention to their nonverbal cues, offering reassurance and validating their emotional responses, acknowledging that it's natural to feel frustrated or sad about such changes. I emphasized that our primary goal was to ensure her safety and continued well-being, and that the increased assistance would actually help maintain her quality of life by reducing the risk of falls and injuries. We then collaboratively discussed the specific types of support we could provide, involving them in the planning process as much as possible, and reassure them of our continuous support and availability for further questions. This empathetic and transparent approach, focused on their understanding and involvement, was crucial in gaining their acceptance and trust in the proposed changes.
How do you manage challenging behaviors in residents with cognitive impairment, e.g., aggression, wandering, repetitive questioning?
Managing challenging behaviors in residents with cognitive impairment, such as aggression, wandering, or repetitive questioning, requires a profoundly patient, empathetic, and person-centered approach, as these behaviors are often a form of communication indicating an unmet need or distress. My first step is always to identify potential triggers by observing the resident, their environment, and recent events. This might involve assessing for underlying causes like pain, hunger, thirst, fear, boredom, overstimulation, or feeling misunderstood. When faced with aggression, my priority is to ensure the safety of the resident, myself, and others. I approach calmly, using a gentle tone of voice and simple language, avoiding any confrontational body language. I try to de-escalate the situation by validating their feelings, offering reassurance, and then gently redirecting their attention to a calming activity or changing the environment if needed. For wandering, my focus is on ensuring the residents' safety while respecting their need for movement. This involves creating a secure but not restrictive environment, identifying safe areas for walking, and often engaging them in purposeful activity or walking with them. Understanding why they are wandering, such as searching for a familiar place or person, can also guide a more tailored response. For repetitive questioning, patience and reassurance are key. I answer their questions calmly and gently, often focusing on the underlying emotion or need for reassurance rather than just the factual answer. Sometimes, a gentle redirection to a different topic or offering an engaging activity can help to shift their focus. Across all these behaviors, maintaining consistent routines, providing appropriate stimulation, fostering clear communication among the care team, and ensuring a calm and predictable environment are crucial proactive strategies to minimize distress and enhance the residents' overall well-being.
How do you ensure residents' voices and preferences are heard and respected in their care planning?
Ensuring residents' voices and preferences are heard and respected in their care planning is fundamental to providing person-centered care, and it's a practice I actively integrate into my daily work. My approach begins with fostering a strong, trusting relationship with each resident, creating an environment where they feel comfortable expressing their thoughts and desires. This involves engaging in unhurried, empathetic conversations, actively listening to their concerns, goals, and preferences about their daily routines, activities, and even seemingly small choices like wake-up times or meal preferences. I use clear, simple language and always check for understanding, empowering them to participate actively in decisions about their own care. When a resident's cognitive capacity may be diminished, I employ strategies such as observing their nonverbal cues, recalling their established past preferences as documented in their life story or discussed with family, and collaborating closely with their designated family members or legal guardians. However, even in these instances, the resident's voice, even if communicated subtly, remains central. During formal care planning meetings, I ensure residents or their chosen representatives are present and actively involved, presenting options and explaining the rationale behind proposed interventions in an accessible manner. All expressed wishes and preferences are then meticulously documented in the care plan, serving as a living document that guides all caregivers. Beyond formal planning, it's about consistently empowering small choices throughout the day and advocating on their behalf to ensure their dignity and autonomy are continuously upheld, adapting the care plan as their needs or preferences evolve.
How do you involve families in the care process while maintaining resident autonomy?
Involving families in the care process is invaluable, as they often provide crucial insights into a resident's life history, preferences, and personality, which significantly enhances person-centered care. My approach prioritizes maintaining the resident's autonomy above all else. This means that my first step is always to ascertain the resident's wishes regarding family involvement and what information they are comfortable sharing. If the resident has decision-making capacity, their preferences dictate the level of family engagement. If capacity is diminished, I then work closely with their appointed decision-makers, such as a power of attorney or enduring guardian, while still striving to interpret and uphold the resident's wishes through their known history and nonverbal cues. Once the resident's consent and preferences for family involvement are clear, I foster open and transparent communication with the family. This includes providing regular, honest updates on the resident's health, progress, and any changes in their condition. I invite families to participate actively in care planning meetings, where their unique knowledge of the resident's past routines and personal values can be integrated into the care plan. I also provide education on the resident's medical conditions and care strategies, empowering them to feel more involved and confident in the care being provided. However, the delicate balance is consistently maintained by ensuring that all family input and discussions align with the resident's expressed wishes and best interests. If there are ever discrepancies between a resident's autonomous choice and a family's desire, my role is to act as a clear advocate for the resident's rights, facilitating communication to find common ground while firmly upholding the resident's right to self-determination as the ultimate guiding principle for all care decisions.
Describe your experience working as part of a multidisciplinary team in aged care, e.g., with doctors, allied health professionals, carers.
My experience working as part of a multidisciplinary team in aged care has been extensive, and I view it as absolutely essential for providing truly holistic and effective care to older residents. As a nurse, I often serve as a central point of contact, coordinating care and ensuring seamless communication among various professionals. I regularly collaborate with doctors by providing concise updates on residents' clinical status, clarifying medication orders, and actively participating in ward rounds to discuss care plans and address any emerging health concerns. With allied health professionals, my role involves implementing their specialized recommendations directly into the residents' daily care. For instance, I work closely with physiotherapists to facilitate prescribed exercise regimes and mobility assistance, and with occupational therapists to integrate assistive devices and adaptive strategies that enhance independence. Similarly, I liaise with dietitians to ensure residents' nutritional needs are met, especially for those with specific dietary requirements or swallowing difficulties, and consult with speech pathologists for communication strategies. Furthermore, I frequently work alongside social workers to address psychosocial needs, facilitate family discussions, and manage discharge planning or transitions of care. Crucially, my collaboration extends continuously to the carers and personal care assistants who provide much of the direct daily care. They are often the first to notice subtle changes in a resident's condition or behavior, and I rely heavily on their observations and insights during handovers and throughout the shift. This consistent communication ensures that our care approach is unified and effective. By working together, leveraging each team member's expertise, we ensure that every aspect of a resident's physical, mental, emotional, and social well-being is addressed, leading to comprehensive care plans and ultimately, significantly improved outcomes and quality of life for our older residents.
How do you handle disagreements or conflicts with colleagues in a professional manner?
It's inevitable to encounter disagreements or conflicts with colleagues occasionally, as we all come from different perspectives and experiences. My approach to handling these situations professionally is always centered on open communication, mutual respect, and focusing on the shared goal of providing the best possible patient care. When a disagreement arises, my first step is to seek a private and appropriate time to discuss the issue directly with the colleague involved. I avoid addressing conflicts in front of residents or other staff to maintain professionalism and respect for everyone. I then articulate my perspective clearly and calmly, using I statements to express my concerns or observations rather than making accusatory statements. For example, instead of saying, "You always leave tasks unfinished," I might say, "I'm concerned about how these tasks were handled and its impact on our workflow." Crucially, I then actively listen to their point of view, trying to understand their perspective, their reasoning, and any underlying factors that might be contributing to the situation. It's important to approach these conversations with an open mind, recognizing that there might be information I'm unaware of or a different valid approach. Our collective goal is always safe and effective patient care, so framing the discussion around what's best for the resident often helps to depersonalize the issue and find common ground. If a resolution can't be reached directly, or if the conflict involves a significant patient safety concern, I wouldn't hesitate to involve a team leader or manager to mediate, ensuring the issue is resolved professionally and effectively for the benefit of our residents and the team.
How do you delegate tasks to personal care assistants or other support staff, and what is your approach to supervision?
When delegating tasks to personal care assistants or other support staff, my approach is always guided by the principles of the 5 rights of delegation, ensuring resident safety and optimal care outcomes. First, I assess the right task, confirming it falls within their scope of practice and aligns with the resident's care plan, such as assisting with activities of daily living, vital sign monitoring, or encouraging ambulation. Secondly, I consider the right circumstance, ensuring the resident's condition is stable and the environment is conducive to safe completion of the task. Third, I verify that I am delegating to the right person, someone who possesses the competence, training, and experience necessary for the specific task at hand. My communication then focuses on providing the right direction and clear communication. This involves giving concise, specific instructions outlining the expected outcomes, specifying any time frames, and crucially, clarifying what information needs to be reported back to me, particularly any changes in the resident's condition or unexpected observations. I always encourage questions to ensure full understanding. My approach to supervision is proactive and supportive. I don't just delegate and walk away. I maintain a consistent presence and remain accessible throughout the shift. This involves regular check-ins, asking open-ended questions about the resident's status, and observing care delivery when appropriate. I view supervision as an ongoing opportunity for mentorship and professional development. I provide constructive feedback, recognizing good performance and respectfully addressing any areas for improvement, always explaining the why behind a certain procedure or observation. My goal is to empower support staff to work effectively and confidently within their scope, knowing that I am ultimately accountable for the resident's overall care and am readily available to provide guidance, intervene if necessary, and ensure all tasks are completed to the highest standard for the resident's well-being.
Describe a challenging clinical situation you encountered in aged care and how you resolved it.
One of the most challenging clinical situations I encountered in aged care involved a resident with advanced dementia who, despite typically being calm and cooperative, suddenly exhibited severe agitation and aggression during routine evening care. He became resistant to any touch, was yelling, and pushing away staff, which was completely out of character for him and posed a risk to both himself and the nursing team. My immediate approach was to ensure the safety of everyone involved by stepping back, maintaining a calm demeanor, and speaking to him in a soft, reassuring tone. While a colleague provided a supportive presence, I focused on a rapid, comprehensive assessment beyond just his behavior. I checked his vital signs, looking for any indicators of acute distress, and systematically assessed for potential underlying physical causes such as pain, discomfort from a full bladder, or signs of infection. Upon thorough examination, I identified that his bladder was significantly distended, indicating urinary retention, which was clearly causing him intense discomfort and distress that he was unable to articulate verbally. I promptly communicated my findings to the medical officer, who then prescribed an intervention for urinary catheterization and some immediate pain relief. After these interventions were administered, I closely monitored his response. Gradually, as the pain subsided and his bladder was relieved, his agitation significantly decreased, and he returned to his usual calm state within about 30 minutes. This situation strongly reinforced the crucial importance of always looking beyond the outward manifestation of challenging behaviors in residents with cognitive impairment, as they are often a nonverbal plea for help signaling an acute physical need. It underscored the value of a thorough and rapid clinical assessment in resolving such complex presentations, ultimately ensuring the resident's comfort, dignity, and preventing further complications.
A resident's condition suddenly deteriorates. Walk me through the steps you would take.
When a resident's condition suddenly deteriorates, my immediate priority is to ensure their safety and initiate a rapid, systematic assessment. My first step is always to call for immediate assistance from a colleague, as 2 sets of hands and eyes are invaluable in an urgent situation. Simultaneously, I begin a swift ABCD assessment, checking their airway to ensure it's patent, assessing their breathing for rate, rhythm, and effort, evaluating their circulation by checking pulse, blood pressure, and skin perfusion, determining their level of disability or neurological status, and finally, exposing them to look for any visible injuries or concerning signs. During this rapid assessment, I also obtain a full set of vital signs, including oxygen saturation, heart rate, respiratory rate, blood pressure, and temperature. Concurrently with this assessment, I implement any immediate basic interventions required. This might involve positioning the resident for optimal breathing, administering oxygen if their saturation is low, or ensuring a safe environment if they are agitated or disoriented. Once a rapid initial assessment is complete and basic stabilizing measures are in place, my next crucial step is to immediately notify the doctor or on-call physician. I communicate the situation concisely and effectively using the SBAR, situation, background, assessment, recommendation format, providing a clear picture of the sudden change, my findings, and what I believe needs to happen next. Following the doctor's orders, I initiate further diagnostics or treatments, such as administering medications, preparing for transfer, or collecting specimens. Throughout this entire process, meticulous and timely documentation of all observations, interventions, and the resident's response is essential for continuity of care. I also ensure the family is updated as per facility policy and the resident's wishes, providing compassionate and clear information. My focus remains on continuous monitoring and reevaluation, adapting the care plan as the resident's condition evolves, until stability is achieved or a new care trajectory is established.
How do you prioritize your workload when you have multiple competing demands in a busy shift?
When faced with multiple competing demands during a busy shift, my primary guiding principle for prioritizing my workload is always patient safety and acuity. I employ a systematic approach to ensure that the most critical needs are addressed first, while still managing other important aspects of care effectively. I begin by quickly reviewing my handover report and the care plans for my assigned residents, making a mental or written list of all planned tasks, scheduled medications, and any residents identified as high risk or requiring specific monitoring. My immediate focus then shifts to any life-threatening or unstable situations, following an ABCD, airway, breathing, circulation, disability, exposure assessment framework. This ensures that any immediate threats to a resident's vital functions are identified and addressed without delay. Following this initial assessment, I prioritize time-sensitive interventions such as scheduled medication rounds, especially for insulin, pain relief, or antibiotics, as well as critical assessments like post-operative checks or new admissions. I then group tasks geographically where possible to maximize efficiency and minimize travel time. I also utilize proactive hourly rounds to check on all residents for safety, comfort, toileting needs, and repositioning, which can often prevent escalation of minor issues into urgent problems. Throughout the shift, I continuously reevaluate priorities as residents' conditions change or new demands arise. I leverage effective delegation to personal care assistants for tasks within their scope, providing clear instructions and ensuring proper supervision, which frees me to focus on nursing assessments, complex care, and critical thinking. If I anticipate any significant delays in non-urgent care, I maintain open communication with residents, their families, and the charge nurse, seeking assistance or providing updates to manage expectations. This systematic approach, centered on safety and continuous reassessment, allows me to manage my workload effectively and provide high-quality care even in demanding situations.
Describe a time you made a mistake in your nursing practice. What did you learn from it?
Mistakes are an inevitable part of any complex profession, and nursing is no exception. I recall a situation early in my career where I made a medication error. I was administering morning medications on a busy shift, and due to a momentary lapse in concentration and not double-checking the medication label against the patient's chart for the final time, I administered a patient's usual diuretic dose to another patient who had a similar name and was in an adjacent room. The moment I realized my error, which was almost immediately after administration when I went to chart and saw the names, my heart sank. My immediate priority was the safety of the patient who received the incorrect medication. I swiftly informed the charge nurse, and together we followed the incident protocol. We promptly assessed the patient for any adverse effects, which thankfully, there were none due to the nature and dosage of the medication. We also notified the doctor, completed a comprehensive incident report, and informed the patient's family, ensuring full transparency. What I learned from this experience was profound and multifaceted. Firstly, it reinforced the critical importance of the 5 rights of medication administration, not just knowing them, but meticulously applying them every single time, even when under pressure or feeling rushed. That final check, especially for patient identification, became ingrained as non-negotiable. Secondly, it taught me the absolute necessity of promptly reporting errors. Hiding a mistake can have far more severe consequences for the patient and yourself than owning up to it immediately. This experience solidified my belief in a culture of safety where errors are seen as opportunities for learning, rather than something to be feared. Finally, it underscored the importance of systemic checks and balances in medication processes, and how as nurses, we play a vital role in advocating for safer practices not just for ourselves but for the entire team and, most importantly, for our patients. This event, though challenging, ultimately made me a more meticulous, accountable, and safety-conscious nurse.
How do you advocate for a resident's rights, especially when their capacity for decision-making might be compromised?
Advocating for a resident's rights, particularly when their capacity for decision-making might be compromised, is cornerstone of my nursing practice and requires a highly nuanced and ethical approach. My foundational principle is that every resident, regardless of their cognitive status, retains their inherent rights and deserves to have their dignity, autonomy, and best interests upheld. My first crucial step is to assess the resident's capacity for the specific decision at hand. This isn't a static assessment, Capacity can fluctuate and be specific to the task. I observe their ability to understand the information being presented, appreciate the consequences of their choices, and communicate their decision. If capacity is compromised, my approach becomes focused on ascertaining their likely wishes and acting in their best interest, drawing on their established routines, nonverbal cues, past expressed preferences documented in their care plan or communicated by close family, and their life story. I then engage in open and empathetic communication with the resident, using simple, clear language and offering choices where possible. Simultaneously, I work closely with their appointed decision-makers, such as a power of attorney or enduring guardian. My role here is to educate them on the resident's rights and ethical principles, ensuring that their decisions align with the resident's known values and best interests, rather than purely family convenience. If conflicts arise between family members or between a family's wishes and what appears to be the resident's best interest, I facilitate discussions, providing objective information and promoting shared decision-making. Should a consensus not be reached, or if I believe a resident's rights are being seriously compromised, I would then escalate the concern to my nurse manager or even consult with the facility's ethics committee or relevant external advocacy bodies, always ensuring every step is meticulously documented. My ultimate goal is to empower the resident's voice, even when it's faint, and ensure their care truly respects their individuality and rights.
Discuss your understanding of palliative care and end-of-life care in the aged care setting. How do you support residents and families during this time?
My understanding of palliative care and end-of-life care in the aged care setting is that they are distinct yet interconnected approaches focused on enhancing the quality of life for residents and their families facing life-limiting illnesses. Palliative care is a holistic philosophy that can be initiated at any stage of a serious illness, not just at the very end. Its primary goal is to provide relief from suffering, encompassing physical symptoms like pain, nausea, and dyspnea, as well as psychosocial and spiritual distress. It aims to help residents live as well as possible for as long as possible, often delivered alongside curative treatments. End-of-life care, on the other hand, is a specific phase of palliative care that focuses on the last few weeks or months of a resident's life when it's clear they are approaching death, with the ultimate goal of ensuring a peaceful, comfortable, and dignified passing. During this incredibly sensitive time, my role as a nurse in supporting both residents and their families is paramount. For residents, my focus is on meticulous symptom management, proactively assessing and intervening to control pain, discomfort, and any distressing physical symptoms. I prioritize their comfort and dignity, ensuring their personal hygiene is maintained, repositioning them gently, and upholding their privacy and wishes regarding their final days. Open and honest communication about their preferences, fears, and any advance directives is crucial, ensuring their autonomy is respected until the very end. I also provide emotional and spiritual support, offering a listening ear and facilitating visits from spiritual advisors if desired. For families, support involves consistent, empathetic, and transparent communication. I provide clear, regular updates on their loved one's condition and the expected trajectory, explaining any changes and what to anticipate during the dying process. I offer emotional support by being present, actively listening to their grief and anxieties, and validating their feelings. I invite them to participate in comfort measures if they wish, empowering them to feel involved in their loved one's final journey. Furthermore, I guide them through practical aspects, connect them with bereavement counseling or other support services, and respect their cultural and personal rituals, ensuring they feel supported and informed throughout this challenging and sacred time.
How do you ensure dignity and respect are maintained for all residents, regardless of their cognitive or physical abilities?
Ensuring dignity and respect are maintained for all residents, regardless of their cognitive or physical abilities, is absolutely fundamental to my nursing practice in aged care. It stems from a core belief that every individual possesses inherent worth and deserves to be treated with the utmost respect, irrespective of their condition or capacity. My approach begins with communication. I always address residents by their preferred name, speak to them in a clear, respectful tone, and avoid any form of elder speak or condescending language. Even when a resident has significant cognitive impairment, I explain every action I'm about to take, seeking their consent through verbal affirmation or nonverbal cues, and maintaining eye contact to engage with them as an individual. Privacy is paramount. I always ensure doors are closed and curtains are drawn during personal care, respecting their personal space and maintaining the confidentiality of their health information. Crucially, I strive to uphold their autonomy by offering choices whenever possible, even for seemingly small things like what to wear, when to bathe, or what to eat. This empowers them and reinforces their control over their own lives. Individualized care is also vital. I take the time to understand each resident's unique personal preferences, routines, cultural background, and life history, and I integrate these into their daily care plan. This means adapting my approach to suit the individual, ensuring their personal belongings are respected, and assisting with grooming and hygiene to help them maintain a sense of self and pride. Furthermore, I see it as my responsibility to be a strong advocate for residents, proactively addressing any instances of disrespect from others, and always speaking up to protect their rights and well-being, particularly for those who are unable to vocalize their own needs or concerns.
What steps do you take to ensure resident safety, particularly in relation to fall prevention and infection control?
Ensuring resident safety, particularly in relation to fall prevention and infection control, is a cornerstone of my nursing practice in aged care. My approach is systematic and proactive, integrating various measures into daily routines. For fall prevention, it begins with a comprehensive risk assessment upon admission and ongoing reassessments, using validated tools to identify individual risk factors such as gait instability, muscle weakness, polypharmacy, visual impairment, or a history of previous falls. Based on this, I implement individualized care plans which might include tailored exercise programs to improve balance and strength, ensuring the consistent use of appropriate assistive devices like walkers, and regular toileting schedules to prevent urgency. Environmentally, I ensure residents' rooms and common areas are free of clutter, well-lit, and that call bells are easily accessible and functioning. I also prioritize appropriate footwear and ensure bed rails are used judiciously and according to facility policy and resident need, always reviewing medications for those that might increase fall risk. Regarding infection control, strict adherence to established protocols is paramount. This starts with impeccable hand hygiene, rigorously following the 5 moments for hand hygiene before and after every resident contact and procedure. I consistently utilize standard precautions, including the appropriate use of personal protective equipment, PPE, like gloves, gowns, and masks, based on the anticipated risk of exposure to bodily fluids. I ensure proper cleaning and disinfection of resident care equipment and the environment, and safe handling and disposal of contaminated waste. Early identification of infection is crucial in older adults, where symptoms can be atypical. Therefore, I vigilantly monitor for subtle changes such as new onset confusion, sudden changes in functional status, or unexplained fever, and promptly implement isolation precautions when an infection is suspected or confirmed. I also actively participate in promoting vaccination programs for both residents and staff, such as influenza and pneumonia vaccines, contributing to a safer and healthier environment for everyone in the facility.
How do you stay updated with current best practices and regulations in aged care nursing?
Staying updated with current best practices and regulations in aged care nursing is a continuous and multifaceted commitment for me, as the field is constantly evolving. My approach combines formal and informal methods to ensure I'm providing evidence-based, compliant, and high-quality care. Firstly, I actively engage in continuing professional development, CPD. This includes attending relevant workshops, seminars, and webinars offered by professional nursing organizations and aged care associations. These platforms often highlight the latest research, clinical guidelines, and technological advancements in gerontology and aged care. For instance, in India, bodies like the Indian Nursing Council increasingly mandate CPD hours for license renewal, which I diligently fulfill. Secondly, I regularly read professional journals and publications specializing in aged care, gerontological nursing, and chronic disease management. Subscribing to newsletters and reputable online health portals also helps me keep abreast of new treatments, assessment tools, and care strategies. Thirdly, I maintain a strong connection with a multidisciplinary team within my facility. We have regular team meetings and clinical discussions where we share insights, discuss challenging cases, and review current practices. Collaborating with doctors, allied health professionals, and other nurses allows for an exchange of knowledge and helps to identify areas where our collective practice can be improved based on the latest evidence. Finally, I make it a priority to stay informed about regulatory changes and policy updates. This involves regularly checking official government health department websites and circulars, particularly those pertaining to aged care standards and resident rights. For example, India's evolving national policy for senior citizens and initiatives like the National Program for the Healthcare of the Elderly (NPHCE) directly impact care delivery. Understanding these regulations ensures that my practice is always compliant and aligns with the highest standards of care. This blend of continuous learning, active participation, and vigilance in monitoring regulatory landscapes ensures that I remain a competent and contemporary aged care nurse.
Describe your experience with quality improvement initiatives in previous roles.
In my previous roles, I have actively participated in several quality improvement initiatives, recognizing that continuous improvement is crucial for enhancing resident safety and care standards. One significant initiative I was involved in focused on reducing the incidence of falls within the aged care facility. We had identified through incident reports and safety audits that falls were a persistent concern, leading to resident injuries and increased anxiety among both residents and staff. My involvement began as part of a dedicated quality improvement committee. My role primarily involved data collection and analysis, helping to identify common times, locations, and contributing factors to falls. This included reviewing incident reports, conducting environmental safety audits, and observing resident behaviors. Based on our findings, which suggested a need for more consistent hourly rounding and better education on call bell use, we collaboratively developed a revised fall prevention protocol. This protocol emphasized structured hourly rounds with specific checks for toileting needs, pain, and comfort, as well as reinforced education for residents and their families on the importance and proper use of call bells. I was instrumental in the implementation phase, which involved educating my colleagues across all shifts on the new protocol, demonstrating the revised hourly rounding procedures, and stressing the rationale behind these changes. We also integrated specific prompts into our electronic charting system to ensure consistent documentation of these interventions. Over the subsequent 3 months, we meticulously monitored the data, tracking the number of falls and the adherence to the new protocol. The results were highly encouraging. We observe a significant reduction in fall incidents across the facility, alongside an improvement in resident satisfaction regarding their responsiveness to needs. This experience truly highlighted the power of a multidisciplinary team approach, data-driven decision-making, and consistent implementation in achieving tangible improvements in resident safety and quality of life.
What is your understanding of incident reporting, and why is it important?
My understanding of incident reporting is that it is a fundamental and critical component of maintaining patient safety and driving continuous quality improvement within any healthcare setting. It's a formal, systematic process for documenting any event, or even a near miss, that occurred or could have occurred, which resulted in, or had the potential to result in, unintended harm to a resident, staff member, or visitor. The core principle behind incident reporting is not to assign blame, but rather to identify underlying systemic issues and learn from adverse events or close calls. Incident reporting is immensely important for several reasons. Primarily, it serves as a vital tool for patient safety. By meticulously documenting incidents, we can identify patterns, trends, and common root causes of errors, whether they relate to medication administration, falls, equipment malfunction, or communication breakdowns. This data then allows the healthcare team to proactively develop and implement preventative strategies, modify policies and procedures, or provide targeted education to prevent similar incidents from recurring in the future. Secondly, it fosters a robust culture of safety and continuous quality improvement. When staff feel empowered to report incidents without fear of punitive action, what's known as a just culture, encourages transparency and open dialogue about risks. This leads to a safer environment for residents, as potential hazards are addressed systemically. Finally, incident reports provide crucial documentation for regulatory compliance and risk management, demonstrating an organization's commitment to accountability and its active efforts to learn from challenges to constantly enhance the quality of care provided.
How do you manage stress and maintain your well-being in a demanding environment like aged care?
Working in aged care, while incredibly rewarding, can undoubtedly be a demanding environment due to the complex needs of residents, emotional challenges, and fast-paced nature of the work. To manage stress and maintain my well-being, I employ a multifaceted approach that focuses on both proactive strategies during my shift and dedicated self-care outside of work hours. During my shifts, effective prioritization and organization are crucial. By systematically managing my workload, I feel more in control and less overwhelmed. I also prioritize open communication and teamwork with my colleagues. Debriefing after challenging situations or simply sharing a laugh helps to diffuse tension and reinforce our collective support system. Ensuring I take my scheduled breaks, even short ones, allows me to step away, clear my mind, and return refreshed. Outside of work, I make a conscious effort to separate my professional life from my personal life. Physical activity is essential for me. Regular walks, especially in nature, help to decompress and re-energize my body and mind. I also prioritize getting adequate sleep and maintaining a healthy diet, as these are fundamental to my resilience. Engaging in hobbies and interests that have nothing to do with nursing, such as reading, gardening, or pursuing creative outlets, provides a vital mental escape and helps to reset my focus. Furthermore, I ensure I spend quality time with my family and friends, as strong social connections provide invaluable emotional support. Sometimes, simply reflecting on the positive impact I've had on a resident's day helps to recenter my perspective and reinforce the purpose of my challenging but deeply fulfilling work. This balanced approach allows me to remain compassionate, resilient, and effective in my role.
What personal qualities do you possess that you believe make you a strong aged care nurse?
I believe several personal qualities make me a strong aged care nurse, all of which are essential for navigating the unique complexities and deeply rewarding aspects of this field. Firstly, compassion and empathy are at the core of my approach. I genuinely care about the well-being of older adults and possess the ability to put myself in their shoes, understanding their perspectives, fears, and needs, even when they cannot fully articulate them. This allows me to connect with residents on a deeper level and provide care that is not just clinically sound but also emotionally supportive and person-centered. Secondly, I possess a significant degree of patience and resilience. Aged care can be demanding, involving complex health conditions, challenging behaviors, and often emotional situations like end-of-life care. My patience enables me to provide calm and consistent support, even in frustrating moments, and my resilience helps me to manage stress effectively, learn from difficult experiences, and maintain my passion for the work without burning out. Furthermore, I am a highly attentive and observant individual. Older adults, particularly those with cognitive impairments, may present with subtle changes in their condition. My keen observation skills allow me to quickly identify these nuanced changes, which are crucial for early intervention and preventing serious complications. Finally, I'm a strong communicator and a dedicated advocate. I can effectively convey information to residents, families, and the multidisciplinary team, and I'm unwavering in my commitment to advocating for residents' rights and ensuring their voices and preferences are heard and respected, even when their capacity for decision-making might be compromised. These qualities, I believe, allow me to provide truly holistic, dignified, and high-quality care.
How do you approach continuous learning and professional development?
My approach to continuous learning and professional development is highly proactive and multifaceted, stemming from my belief that nursing is a dynamic profession where staying current is not just a requirement, but an ethical imperative for providing the best possible patient care. Firstly, I rigorously ensure I meet all mandated continuing professional development (CPD) requirements set by regulatory bodies, viewing these as a baseline for maintaining competence. Beyond compliance, I actively seek out opportunities to deepen my knowledge, particularly in areas relevant to aged care. This includes regularly attending workshops, webinars, and seminars focused on gerontological nursing, dementia care, palliative care, and chronic disease management. I also make it a point to subscribe to and read professional journals and reputable online nursing publications, staying abreast of the latest evidence-based practices, clinical guidelines, and research findings. Furthermore, I value informal learning immensely. I actively engage in discussions with my colleagues and mentors, seeking their insights on challenging cases and learning from their experience. I also regularly reflect on my own practice, identifying areas where I can enhance my skills or knowledge, and then seek out specific learning resources to address those gaps. For example, if I notice an increase in a certain type of skin breakdown, I would proactively research the latest wound care protocols. This blend of formal education, self-directed learning, and collaborative knowledge sharing ensures that my practice remains evidence-based, compassionate, and aligned with the evolving needs of older adults.